So excited to begin with introducing Ashanti Daniel, BSN RN, who has been an advocate with several chronic illnesses and nonprofit organizations and has shared her stories in their events, national press events, and Congress. Ashanti is a Black woman with a disabled registered nurse, a single mother living with ME in Southern California. She speaks powerfully, not just to what it is to live with a chronic illness like ME, but what it is to try to get appropriate care as a Black woman navigating structural racism in our current healthcare system. As a former healthcare professional and patient advocate, Ashanti has been educating women of color about ME, CFS, and Long Covid while working to secure recognition for better research as well as care for patients. Ashanti, welcome. We're so excited to have you. She is joined by Jalen Mercadel, who is also a patient at the Chronic Fatigue Clinic in Johns Hopkins Children's Center. After 2 years of navigating the healthcare system with disabling symptoms, she was diagnosed with chronic fatigue syndrome along with other multiple conditions in August 2021. Professionally, she obtained a BSN from Emory University in 2017 and has worked as a registered nurse in the oncology setting for 5 years with certification in bone marrow transplant. Jalen continues to use her education, knowledge of the system, and access to quality health insurance to navigate the healthcare system for her own challenges while serving as a patient support advocate for others as well. Ashanti, Jalen, thank you so much. I'd love to turn over the floor for your opening comments about the medical topic here today. Ashanti, if you join us first.
Thank you. I appreciate you, Emily. Good morning, everyone. Super early morning for my fellow West Coasters. My name is Ashanti Daniel, and like Emily said, I am a disabled registered nurse turned advocate, single mother, former fitness enthusiast, and person with the sudden onset of post-viral ME nearly 7 years ago. Ironically, or maybe not so much, I was diagnosed with ME on International ME Awareness Day in May 2017, 9 months into my illness. I don't know what any of your belief systems are, but I took that as a sign that the next stage of my life was definitely going to include advocacy. Occasionally, I look at it as ME taking my career away in exchange for a role in advocacy work for the ME and now Long COVID communities. As what I consider to be a veteran in chronic illness land, there are many things I wish I knew at the beginning of this illness. However, I am only going to share 3 of those things today. The first and one of the most important things I really wish I knew that could have significantly changed the trajectory of my illness in a positive way, and that is the importance of pacing. Even as a nurse, I have to admit, I had no real knowledge of ME and absolutely no concept of post-exertional malaise, PEM, or pacing. Pacing may have saved me from the devastating PEM I experienced doing yoga 5 months into my illness. Believe it or not, yoga. Yes, yoga. You know, most people think yoga is a cure for chronic illness, but that's a different discussion. Anyway, the PEM that the yoga triggered resulted in a permanent worsening of my symptoms. I went to yoga before my official ME diagnosis, thinking I was doing something good for my body to help it recover from what was ailing me. Boy, I could not have been more wrong. It's been over 6 years since my last yoga class, and I have yet to return to my pre-yoga level of functioning, unfortunately. So to those of you who are at the beginning of your illness, please, please, please listen to your body when you feel wiped out. And even when you feel, quote, decent, okay, semi-normal, pacing, though not easy at all, I'll be the first one to tell you, is critical. And speaking of pacing not being easy, I want to point out that Amy, one of our other speakers, will be discussing pacing in more detail towards the end of this roundtable session. Another thing I wish I knew in the beginning of my ME journey was that being a healthcare professional would not shield me from the medical racism that Black women frequently encounter in our healthcare system. Clearly, I'm not awake yet. I can't speak this morning. Just kidding. Anyway, while I have experienced structural racism in healthcare several times throughout my illness, I would like to discuss an example of medical racism that I endured just last month. You know, it's the gift that keeps on giving. For 4 years, I went to the Cedars-Sinai Ambulatory Infusion Center for IVIG infusions twice a month. On one of my infusion days last month, I had been awake most of the night, quite ill, and woke up still having a terrible, very high symptom chronic illness day. I am extremely dependent on my IVIG infusions, so I didn't want to cancel. I somehow got myself together, including accessing my own port per usual, and my ride took me to Cedars for my 11-hour infusion day. I was late that morning, quite late, but called the infusion center to let them know I was really struggling, but would be there. As part of my highly specialized infusion protocol, I receive a large dose of IV Benadryl prior to my infusion and every 3 hours for the duration of my infusion. I don't know about any of you, but I am sensitive to Benadryl. It puts me into what I refer to as a quote Benadryl coma. I literally wake up from my Benadryl slumber with a mask full of drool. Yes, a mask full of drool, yikes. On this particular day, I was rudely awakened from La La Land by the associate nurse director, keyword nurse, of the infusion center, so she could scold me for being late. Yes, you heard that correctly. And yes, again, she is an RN. There was no reason to wake me. And I told her that, as you know, there was no emergency. This conversation could have been had at another time. Before you ask, this associate nurse director was aware of the fact that I was extremely unwell that day, but she did not care. Her only concern was her agenda to chastise me. In that moment, I was not viewed as a human, but as a quote, naughty little Black girl who needed to be reprimanded. During our interaction, I let her know I would not be having the conversation she was trying to have with me while I was under the influence of Benadryl and had just been sound asleep. I also asked her where her compassion was as an RN for a sick, sleeping patient. Although I told her I was not going to have that conversation, or any conversation for that matter, she continued to terrorize me with her words anyway. I then said, and I quote, "I created a boundary and I need you not to push back on that." Do you think she stopped talking and walked away? Nope. She completely disregarded my boundary and proceeded to continue bullying me. She knew I was unable to get up from the infusion chair to move away from her. So in order to enforce my boundary and make her leave me alone, I did the only thing I could do at the time. I literally stuck my fingers in my ears like a toddler and closed my eyes. Do you think that was the end of that? Of course not. Following our interaction, that woman made it so I could no longer get my infusions at the Cedars Ambulatory Infusion Center. Now, remember, I had been getting my infusions there for 4 years, twice a month. So, her perception was, how dare I, a Black woman, have the audacity to advocate for myself and set a firm boundary. So she made sure I was punished, as is often the case when Black people, particularly Black women, stand up for themselves against people who clearly view us as less than human. I definitely wish I knew at the beginning of my illness that being a healthcare professional was not going to make me immune to medical racism. And yes, that associate nurse director knew I am a nurse. I'm sure most of you watching this are dumbfounded right now, and I didn't even share every detail about what went down, but this is the reality of being a Black woman accessing healthcare in this country, healthcare professional or not. Okay, now after that really heavy example, I'm going to end on a lighter note. The third and final thing I wish I knew early on, and this is a big one, and that is that fellow patients in the chronic illness community, even if they don't have your exact same illness, are often far better resources than anyone, including healthcare professionals. Chronic illness warriors are so knowledgeable, helpful, validating, compassionate, and empathetic, just to name a few. I personally am happy to help new members of the chronic illness community in any way I can. I can be found on Instagram or Twitter. My handle on both platforms is @AshantiRN. Please feel free to reach out to me anytime. We are all in this together. Thank you.
Wow, Ashanti, thank you for those amazing comments and some really great insights. I'd love to turn it over to Jalen now to round out our topic of the medical perspective.
Yeah, hello everyone. Good morning to those who are here. Thank you, Emily. Thank you, Ashanti, for your advice and story. That was amazing. I was diagnosed with ME/CFS in September of 2020. And I guess just want to start with why I was probably asked to speak today. So I was presenting symptoms or started presenting symptoms at the beginning of 2019. Before that, I was an inpatient nurse in my early 20s, living my best life. I had some odd symptoms here and there, like you grow up with, but really consider myself healthy. Started presenting symptoms. and really started declining pretty quickly. Was sleeping 16 hours out of nowhere, just really random stuff. I started seeing all these different specialists. And really people were telling me things were abnormal. Some tests were coming back, but no one could really give me a full diagnostic picture of what was going on. I ended up having a stroke-like event at work in the middle of that same year. I got to the ER. And after 12 hours, they told me I was having an anxiety attack. And when I asked what were the symptoms that were needed, like if this happened again, when should I come back, if I should call 911, and they told me if I found myself unconscious, and that's what they told my family. So we left. I, at that point, fought before we left for an outpatient neurology appointment. Before that appointment, I fought to have MRI imaging done of my spine, my brain, which I did get. And then when I got to that appointment, the provider told me that they had read my scans, but that they were diagnosing me with conversion disorder, which is now known as functional neurologic disorder. For those of you who may not know, that disorder, you present physical or sensory symptoms when you do not have an underlying neurological condition. And a lot of times it's associated with a mental health condition. So from there, I was sent to psychiatry, where I spent 6 months with them, the whole time declining rapidly. Multiple psychiatrists saw me and said they did not feel like I had conversion disorder. They sent letters and spoke with the neurologist, rheumatologist, different specialists I had seen to ask that I be worked up further, and was declined. That 6-month period where I was seeing psychiatry, I actually started referring myself out to different specialists and was getting to appointments, and people, the providers, after, doing their little assessment, were sitting down with me and saying, well, we're really sorry, but there's nothing further we can do for you. And it was really confusing to me because I was showing up with all of these symptoms and abnormal testing and wasn't really getting anywhere. At that time, the system I was in didn't have a patient portal, so they didn't have clinic notes you could see, so I was requesting them. When we finally started looking at the clinic notes, that's when I realized I was being blacklisted as a patient pretty much. Providers were seeing the diagnosis of conversion disorder, anxiety, and pretty much just saying, we're not going to take you as a patient, or there's nothing we can really do for you. At that point, I made the decision to go out of state because I was having gait issues. My walking was affected. My speech was affected. I was having choking episodes, multiple things going on. So I decided to go to a national diagnostic program out of state. They were luckily able to diagnose me with POTS, but they couldn't give me an answer for everything else going on. From there, I was referred to Johns Hopkins Chronic Fatigue Syndrome Clinic, and it literally changed my life in a couple of months. And that in one visit was where I was diagnosed with EDS and mast cell and ME/CFS and all of these things. And we're told, oh, you also need to see a neurosurgeon like now. And then in that next month, I actually was told I needed immediate spinal fusion surgery. And I'm happy to say, waking up from that surgery, most of my neurological symptoms were gone. So what my advice, I wish I would have known, what I would give to someone is specifically in regards to delays in treatment or diagnosis, especially with the energy limiting disability and saving yourself time, starting with support groups, local or regional. If you've been in one that maybe you didn't feel inclusive in or that it was a good fit for you, try another one. Usually support groups, a lot of them will have doctors or providers lists that they put together for their local providers that are super helpful for providers who will treat you with great bedside manner, and even will have some to avoid, unfortunately, and that is the case. The second I would say is if you find yourself in a medical system, so the same hospitals all under one name, I won't list any names, but get out of that system. So if you're finding you're running up against a wall and you're not really getting anywhere, providers aren't further treating you, try to move into a different system and see if that helps anything. The third I would say is if you have any MECFS long COVID clinics in your area, I know the appointment and wait lists are insane now, but at least just get on the list. That resource is beyond beneficial to have with you. And then this is a little bit out of left field, but a lot of expert clinicians, sometimes if you Google, you search their LinkedIn, if you find that they're doing research or things that you feel like you would benefit from treatment, finding their emails and emailing them and saying, you know, hey, I have this going on, I'm running into a brick wall with these things. Do you have any recommendations or a provider you could refer? You'd be surprised how many people have gotten with that. So those are my recommendations. And really at the end of the day, believe in yourself. You are also an expert in the room that you're in about your body and yourself. So always remember that. And thank you.